Hi, in today's video, we'll go through two clinical questions that test your understanding of important medical concepts. The first case helps us focus on identifying the underlying cause of a genetic connective tissue disorder, and the second question highlights key physiological aspects of a hormone involved in regulating blood pressure and electrolyte balance. A 32-year-old woman presents with sudden onset of chest pain radiating to her back. On examination, she is tall, has hypermobile joints, an arm span longer than her height, and long, thin fingers. Ophthalmologic records show a history of lens displacement. Imaging reveals an intimal tear in the ascending aorta consistent with a dissection. A genetic connective tissue disorder is suspected. A defect in which of the following is the most likely underlying cause? Now, this question assesses your ability to identify Marfan syndrome, which is a genetic connective tissue disorder, and we should link it to its underlying molecular defect. The clues which are given in this question is the classic triad of skeletal abnormalities, ocular findings, and cardiovascular complications pointing towards this diagnosis. The options given here are A. Collagen type 1, B. Collagen type 2, C. Desmosine, D. Fibrillin, E. Synovial fluid. The correct option here would be D. Fibrillin, and that is because this patient has Marfan syndrome, which is an autosomal dominant connective tissue disorder caused by mutations in the FBN1 gene marked by skeletal, ocular, and cardiovascular abnormalities. It results from a defect in fibrillin, which is a glycoprotein essential for the structural integrity of connective tissues. Let's have a look at why the other options are incorrect. Option A is incorrect because structural defects in collagen type 1 cause osteogenesis imperfecta, which is a condition characterized by skeletal deformities, a blue discoloration of the sclera, poor tooth development, hearing loss, and dwarfism. None of these symptoms are consistent with the patient described in the question. And option B is incorrect because structural defects in collagen type 2 cause dwarfism. Option C is incorrect because desmosine is a constituent of the extracellular matrix. Patients with Marfan syndrome do not have a defect in desmosine. And option E is incorrect because synovial fluid is typically normal in Marfan syndrome. A 35-year-old man is evaluated for persistent muscle weakness and fatigue. He reports frequent leg cramps and has recently been diagnosed with high blood pressure during a routine checkup. Physical examination reveals elevated blood pressure. Laboratory findings are shown in the table below. A follow-up abdominal imaging shows a well-circumscribed mass in the left adrenal gland. Which of the following hormones is most likely elevated in this patient? Now, the values of the electrolytes given in the table below, potassium is lower than the normal range, sodium is higher than the normal range, bicarbonate is higher than the normal range, and glucose is higher than the normal range. So potassium is low, but sodium, bicarbonate, and glucose are high. The options given here are A. Aldosterone, B. Cortisol, E. Epinephrine, D. Glucagon, E. Thyroxine. The correct option here would be A. Aldosterone, and that is because this patient most likely has primary hyperaldosteronism, which is often caused by an adrenal tumor that produces excess aldosterone, typically presenting with high blood pressure, elevated sodium and bicarbonate levels, and reduced potassium, leading to hypokalemic metabolic alkalosis. Also, elevated aldosterone concentration in primary aldosteronism are associated with impaired glucose tolerance and type 2 diabetes. Let's have a look at the physiological actions of aldosterone in order to better understand the pathophysiology of hyperaldosteronism. Now, aldosterone, which is a mineralocorticoid hormone, is secreted by the adrenal cortex and is responsible for regulating electrolyte and fluid balance. Then it acts on the distal convoluted tubules and collecting ducts of the nephrons, and it is the primary site in the kidney where aldosterone exerts its effect. It upregulates the epithelial sodium channels and the sodium-potassium ATPase pumps, promoting sodium reuptake into the blood. As sodium is reabsorbed, potassium and hydrogen ions are secreted into the urine. This leads to increased water retention and blood pressure because sodium and water retention expand extracellular fluid volume, and they help maintain blood pressure and volume homeostasis. Let's have a look at why the other options are incorrect. Option B is incorrect because cortisol could produce the moderately elevated glucose but not the high serum bicarbonate and elevated serum sodium levels seen in this patient. Option C is incorrect because increased levels of epinephrine could explain the hypertension but would not produce the hypernatremia and the hypokalemia. Option D is incorrect because elevated glucagon levels would produce an elevation in blood glucose but not the hypernatremia and hypokalemia seen in this patient. And option E is incorrect because thyroxine would not produce the high serum bicarbonate and elevated serum sodium levels seen in this patient.